because questions will come into us that we will probably not be able to have time to answer, or you may think of some afterwards. So, and we will forward them on to the correct person. So feel free to use that chat box. We're going to put in our Aventura Marketing Council information in there right now.
And Elaine, we're going to get started because we want to grab a little more time for our speakers to have time to talk to the folks who are participating. So are you going to be introducing Gary to us?
Absolutely. I think Gary is ready to start. Where are you, Gary? Gary's ready
here.
to start. Okay.
I'm just waiting for the green light.
Green light. You got the green light.
All right, I got the green light. Well, welcome everybody and happy Tuesday. Thank you for taking your time out this morning for the next hour to hear a fantastic group of speakers and presenters on our quarterly CHOAB meeting addressing associations, board members, and managers. My name is Gary Pyott, proud chairman of the board for the Aventura Marketing Council, Chamber and Commerce, and also involved with Campbell Property Services and Management, which we are one of the sponsors today as well. As Dr. Marks and Elaine said, we're happy to have you here this morning. We do have a fantastic program covering everything from masked gyms, guest elevators, and pools. Just a reminder, everyone that is not presenting this morning, please keep yourself on mute and use the, as Michael Stern said, the chat box. Put all your questions in there, put your information in there, anything that you'd like to communicate to an individual or to the group, please use the chat box, the chat mechanism that we have, and Michael will be monitoring that through the meeting. To stay on time and everything, what I'd like to do right now is turn it over to one of our sponsors, and that is continuous friend and sponsor, always here when we need them. That's Hotwire Communications, and today I will turn it over for a couple of minutes to David Ramos. David?
Thank you, Gary, and good morning, everyone. I'm David Ramos, Executive Vice President with Hotwire Communications here in South Florida. For us, obviously, this particular session is right up our alley. One, you're going to be discussing increasing property values, which is what our products do, and the intent is to help bring more value to your residents, to your communities. We bring state-of-the-art fiber optic technology, gigabit internet. You basically take technologies that have been in your homes, in your communities for many years, and just completely revamp them, completely upgrade them, give your residents and board members and property management staff just the full offering of the latest and greatest in everything from gigabit internet to 4K TV and everything in between. But the goal is to ensure that we bring added value to your communities and just give you a different flavor of what dealing with a traditional legacy cable company, give you a different spin on that. Second, dealing with crisis and a pandemic. And for us, we had to go 100% remote back in March. And so we took over 1,000 of our employees in the market and set them up to work from home in less than a week. Thankfully, our customers haven't felt that impact, and it's no different to them. Our employees have been operating from home and from the field as business as usual, providing great services. Our infrastructure, our technology is built to provide best and the fastest internet possible. So obviously this pandemic tested that concept firsthand, not just the product, but how we service our accounts and our communities. And I can tell you that this team that we have on the ground and at home has done an incredible job. Our customers, obviously, that have been stuck at home and with their families and working and doing school and everything else, have really put our network to the test, and our network has stood up to the challenge. The reviews are endless. You can go to our website and just see the feedback from our residents and our customers, and it's a very proud moment for us. In the process, we've been a part of many community efforts. This past weekend, we provided over 350 backpacks, laptops, internet connections to students that were without. So not only is our team working hard to make sure your services are always up, working well, but they're also out there helping those less fortunate and in need. So couldn't be prouder of the Hotwire team. Hotwire's been around now going on for 20 years. Proud member of the Aventura Marketing Council, and thank you, Elaine and Gary, for always thinking about us. If you're in a community that just isn't satisfied with your cable TV provider, internet provider, give us a call. We serve hundreds of properties in the Miami Beach, Sunny Isles, Aventura, Holland to Hollywood market, and everywhere across Dade and Broward. And we'd love to give you an opportunity to see what we can do for your community. Overall, I hope everyone enjoys the session and takes a lot out of it. And again, if we can do anything to help from a technical perspective, your communities or your property management companies, please don't hesitate. My information is in the chat. Thank you so much, Gary, and good luck today.
Thank you very much, David. I will turn it over for a few welcome and remarks to our CHOAB committee person, Dr. Linda Marks.
Hi, Gary, and hi, all of you who have joined us this morning. We're thrilled that you're here with us. Some of you, it may be your first time. Others, you may have been with us through the whole 3 years of the process of developing CHOAB and participating in what used to be in-person events. And now, of course, we are all virtual, but we look forward to the time when we can all meet together, have a beautiful lunch together, and hear the wonderful sponsors and discuss the great types of things that we talk about. I want to just mention the format will be about 5 minutes per speaker, and after that, we're going to have about 5 minutes of questions. And if there are more questions than that in the chat room for a particular speaker, we will send the information, your information, to the speaker so that they can reply directly to you. And we hope that that will work for you. We'll be monitoring the chat group throughout this particular meeting, and hopefully we can get as much done as possible. We also want to thank our sponsors, Campbell Property Management and Hotwire Communications. And one of our favorite parts of this meeting is we always have a drawing for door prizes. And this will be no exception, except we won't have in-person little pieces of paper. Instead, what's going to happen at the very end, everybody will be assigned a number, and we will select numbers for all of you. And 2 of those numbers will be chosen, and we will reach you after and tell you that you have won a wonderful gift card to Bonefish Grill. And we hope that no matter where you live, whether it's down here in Aventura or up in Fort Lauderdale, that you will enjoy an opportunity to have a meal at Bonefish Grill. So we're going to get started right now. And I'm going to talk to you a little bit about the drama. I am a Master Association Board Chair at the Point in Aventura and former president of our condo building. And I will talk to all of you who are board members at this point, and our property managers I know are going to relate to this as well. But we are finding that right now there's a huge depression that's going on among people. There's a lot of anxiety. Many people have really just kind of stayed, if not in their house, very close to their home. And as a result of that, what happens is a paradigm takes place where people have nothing really that special to do, and B, the more depressed or the more upsetting this is and the longer time goes on, they get angry, and there needs to be a release. So for those of you, and I wish I could see you all in person right now, but I can't. For those of you who are board members, and I'm sure for those of you who are property managers also, they are taking it out right now on you. So since they have nothing, else to be angry about right now while they're home, then you're it. So tag you're it. So if you're getting mean-spirited emails right now, or you're having people call you, please understand it's part of a much larger paradigm that pertains to the pandemic. It's not you, it's the times. And we just have to all know that we're working very hard to do a really good job for our folks, in whether it's at the building level or at the Master Association level, and it's just not simple. So, put it in perspective, pat yourselves on the back, you're donating your time, you're taking care of your folks, and everyone deserves a huge pat on the back. Having said that, I'm going to talk a little bit about some of the stuff that you're facing right now, and the first one is masks. So and we have a doctor here who's going to talk to us later, and I hope she addresses this, but if we believe in science and medicine, then we understand that masks help prevent the spread of the COVID virus. We also understand right now that we're dealing with politics, and in politics, there may not be that same belief system. So those of you who are requiring masks in your buildings, keep doing it. Keep doing it, even though it may, you know, the governor may be lifting things all the time and changing things and masks are not required. But the bottom line is we are in communities where we have many, many people living together. And masks in your elevators and masks in your common areas just help prevent that spread. So even though you may be getting a lot of drama about it, I'm going to strongly recommend to you that just hold your guns on this one, because you need to honestly know that you're doing the right thing if you're requiring masks. And again, you're not only protecting yourself, but you're protecting all of the residents who don't have the authority to make those kinds of decisions. So please do, you know, continue if that is a policy in your building. Now, we're also going to be talking about what kind of rules and regulations can be implemented. From some of you may have totally closed your buildings at the beginning of the pandemic. And now there's a big discussion about what do we loosen up. Some of you have allowed visitors. Some of your buildings are still closed. That needs to be a board decision based on your particular community and what that looks like, and how many COVID cases have you had so far, and do you still have COVID cases now? And again, I think it's important to really analyze what are we doing and how are we doing it, and you're going to at some point need to be opening up your buildings at least slightly. Some buildings are allowing 1 or 2 visitors at this point. Some buildings are totally wide open. And again, remember, the more folks who come through, the more folks who are in your elevators, the more possibility that the germs can come with the folks. You have a decision that you have to make about realtors. Realtors are bringing in people from the outside. They can be coming in from another country, or they can be coming in from another state, or they can be local folks. So again, decisions about, so does a realtor, do you allow realtors? And if you do, how many people do you allow? Do you allow 5, 6, 7 people? Can a realtor come 4 or 5 times a day? Should the realtor just come once a day? Again, boards, these are things you want to take up and discuss, and you want to do it within the parameters of what will keep our residents as healthy as possible. Talking about gyms for a moment. If you have a gym that is staffed, so you have folks who are working there, then the discussion needs to be, how can we safely allow people to use as many of the amenities that as we can, because people need an outlet. So one of the very successful models with the gyms is to have people sign up, and this is for a manned gym right now. Have people sign up, depending on the size of your gym, you would allow a certain number of people to come in, and you give them an hour time slot, and then you close for half an hour, and you have your folks wipe down the equipment, clean everything up, and then you open again for an hour. That model seems to be working well. Now, there are other gyms that are not manned at all. They're just, areas that you go down to. And in that case, what you have to really talk about is, how can we keep everyone safe? And at that point, the responsibility needs to fall onto the users of the gym. And you'd need to develop a set of rules where your users literally can take the wipes that you should probably have available to them, make sure they clean before and after. And again, you have to decide, will your residents follow those rules? Will they actually be respectful to the next folks who are coming in? So it's a discussion where you really need to think and talk about, what would work in our particular building, because every single building is different. And then a big thing that I've dealt with both at the point where I live, as well as I'm a city commissioner in the city of Aventura, and we've had a lot of requests from buildings because they have not really known how to open their pools. And we have, again, pools that have staff and pools that don't have staff. So with staff, you can go ahead and divide your, move your chairs around, have space between them, and your staff can monitor the chairs and everything else. Where you don't have staff, again, it's the same decision. Do you supply chairs? Do you ask people to bring their own chairs? But nevertheless, the more you can open in your amenities safely, the more you're helping your residents get through this challenging time. So really the overarching thing that you want to think about is that you absolutely positively want to keep as safe as possible. Ask the medical experts in your community. They will help you and give you suggestions. Call your cities because they're making the decisions about all these different openings. So call and ask your cities what they recommend. But no matter what, let me just say, as a board member to a board member and also to our property managers, really know these are the hardest times. There's no book on this one. So what you're doing from your hearts. And on behalf of all of you, I want to thank you so much for everything that you've done. And if there are any questions, I'd be happy to answer them.
Dr. Marks, this is a question that was sent about a week ago. So let me read that to you. You already have this question, but I'll read it to you in case you don't have it in front of you. Our pool is open for 3 days a week without anyone supervising it. Can we go to full time with no supervision and have guests on the outside attend? Is it supposed to be supervised by the residents who are asked to follow CDC guidelines? And this is from Carol Ellis from Lantern Walk Association.
So guests are a whole issue. Are you allowing guests or are you not allowing guests? And a lot of it has to do with numbers. If your residents use your pools and they really take up most of the pool, you may not want to allow guests at this point, but you're all going to have to be thinking about the holiday season, the November, December, January, when so many more people come down, and you are going to have to think about how to manage effectively having those guests because, grandparents have their grandkids down and parents have the kids down and on and on and on. And so you have to really think about how can we best do it. An unmanned pool, you send out a set of guidelines and people are expected to follow the guidelines. And if they don't follow the guidelines, what most condos do is they just restrict you from using that pool again. I hope that answers that question.
Thank you.
So, Mike, I have a question. It's Alan Brown from Mystic Point Tower 300. We're getting pushback as a board with regards to them saying what's legal and not legal with regards to guests, pool, and gym. Obviously, all the buildings on this island are different. We do not have anybody manned for our gym or our pool. So we're trying to compensate and balance to open up as much as we can. But a lot of people are threatening us with, what you're doing is illegal and so on and so forth. As a board member, and I know we're under unprecedented times, the decisions we make are how are we protected and what's our best route of handling that. I know everybody's in a little state of, obviously, shock of what's going on, but, how do we cover ourselves as best as possible?
So first of all, check with your attorney. Really, check with your attorney.
Okay.
But second of all, frankly, you can have stricter guidelines than the city or the county or the state if you feel that there's a reason for the guidelines. But again, specifics, I would check with your attorney because there are things you can do and things you can't do. And the best, your attorney knows your area, your buildings, and your complex, and I think he or she will give you the best advice.
Thank you.
All right, nothing else at this time, Dr. Marks.
All right, then we are going to move on. I want to thank you all for your time for this little update. And we are now going to move to a sponsor recognition, and that's going to be calling on Gary Pyott from Campbell.
Thank you, Dr. Marks, and thank you, everybody. And as Dr. Marks said, it is a very interesting time right now within associations. And yes, the offices, the staff, whether you're maintenance, whether you're janitorial, whether you're administrative and in the office, it is just a stressful time right now. So as board of directors, as property managers, as residents within communities, please just keep that in the back of your mind when you're talking to and dealing with your association staff. So today I have the pleasure actually of wearing many hats today. I have the pleasure of being the chairman of the board for the Aventura Marketing Council Chamber and Conference. I also have the pleasure of being one of today's sponsors on behalf of Campbell Property Management. After that, I also have the pleasure of being one of your presenters on increasing property values inside and out. So first of all, on behalf of Campbell Property Management, we are a pleasure to be one of the sponsors for today. We are Campbell Property Management, has over 9 offices, satellite offices around the state of Florida in South Florida. Our main office is east of 95 off of Hillsborough Boulevard. We are the oldest family-owned property management company within the state. Bill Campbell, the leading partner for Campbell Property Management, his grandfather started Campbell Property Management over 50 years ago. Campbell Property Management manages over 400 associations, and we have over 800 staff members working from Dade County all the way up through till Vero Beach, which is north, about 3 hours north of where we're sitting here today. Our primary goal is property management. That is our focus. We spend a lot of time on delivering quality of services to our clients through processes, through training of our managers, but our core goal, as you would say in the business, is property management. Many of our clients, over 80% of our clients, have been with us for more than 15 years. And like I said, our Bill Campbell, who is the grandson of the founder, still believes in that today. So on that note, if we can provide any services to anybody that's on today and you're looking, especially coming into budget season, please do not hesitate. I'll put my contact information on that part in the chat room in just a little bit. But besides that, you always know you can reach me at the Chamber of Commerce. That being said, I'm going to move into my section. I've been given 5 minutes and 5 minutes to do my presentation and bring some things to you, and then 5 minutes or any time for Q&A. My part today is increasing property values inside and out. So being in the property management business for over 20 years, when I was preparing for this, I looked at what would be the easiest way to communicate to everybody on the Zoom meeting today, and at the same time deliver that point in increasing property values and inside and out. Many of you, whether you're property managers on this Zoom today or your board members, we all know that first impressions in our communities, and when people drive in, when they walk in, those impressions, not only from a real estate standpoint, but from a unit owner standpoint and a board standpoint, those are what we should be spending our time on. So for my quick time today, I will talk over it, but I put together a little slideshow for my 5 minute. I'm going to share the screen now, and I'll walk you through what I think. All of these pictures that you will be seeing are all pictures of communities here in Aventura. All pictures are in Aventura. I spent some time the other day going around. Can everybody see these? Just wave your hand if you can see these. Perfect, thank you. So as I said, I spent some time over the last couple of days driving around Aventura as we manage several associations, but other associations that we don't, and looking at it from property values inside and out. What I did was take some pictures and speak on that concept of first impressions. Many of you, and I kept names for the most part out of here, but first impressions. Here's an entrance, and many of you will probably know inside yourself when you're thinking about this what community this is. But first impressions, it's clean, it's neat, it's taken care of, it's well maintained. So people see first impressions in regards to pictures like that. Here's another one, an entranceway to a community right here in Aventura. It's clean, it's landscaped, it's cut. Okay, you see the picture on the left-hand side, which is an entranceway to the community. It was just recently pressure cleaned and repainted. The pavers were just recently cleaned up and some paving work done by the Master Association. You see the landscaping that's done on a weekly basis. Nothing special. There's nothing special about that picture, but it's well maintained and it's well presentable. You see the picture on the right. Again, nothing special, simple fountain in front of a building, but the pavers are clean, they're neat. It's well maintained. Janitorial has a daily role in that community to go out there and keep it looking good. This picture here, I think a follow-up with Dr. Marks is very important. How many of you in communities have seen our infamous in property management and communities, you've seen our infamous 8.5 by 11 pieces of paper all over the place? Whether it's in gyms, whether it's in lobbies, whether it's taped inside or outside elevators, if you will. This association here right on the circle, as we know, this pandemic is going to last, as Dr. Marks said, for a long time. We're going to be in this. This isn't something that's going to end in the next 30 days or 60 days. So this particular association said, you know what? We have a responsibility to keep our community clean. We have a responsibility to deliver a clear and precise measure. So they went out and purchased these signs that everybody needs in association management, but they did it in a manner that conveys the message, that's clean and neat, but that's professional, taking away and taking down all of those paper signs that we're so familiar with. The shopping carts, many of us in this condominium world here in Aventura in condominiums have these. Again, well-maintained, well-presentable. That carpet on the bottom, you put your condominium logo on, and it's cheap, it's reasonable, but it makes an impression, not only to people coming into your community, but to your residents that come in and out and use those every single day. Here's an example of the new Park Square. We all know that one of our biggest, let's say, I don't want to say problems, but one of our biggest things in condominiums is what do we do now that everybody's home and we store packages? Our front desks have, when they were constructed and our buildings were built, they have limited capacity, limited stuff to put places. So here's an example of the new Park Square. One of our big new facilities in Aventura. My daughter lives there. What did they do? They put this automatic package center. Somebody comes in, you get a notice there, and it's there. These can be constructed in condominiums as well. Again, first impressions and entranceways. You see at the entrance of this condominium, they changed their flowers out. Very budget conscious, not expensive, but what they did, again, first impressions. You see the concierge, many of you on this call have front desk. You see the standards keeping people 6 feet away. You see the plastic there on the counter. So we all during these times observe what we're supposed to be doing, but you also see a uniformed, a sharp front desk person with all of the safety measures, with the mask, with the rubber gloves and things like that. Again, clean and neat. Here's a couple of other things we all use: first impressions, property values inside and out. Everybody's keen on fitness now, right? So here's a fitness room, but clean, neat, fitness equipment taped off. Everybody's respectful of what's going on. To the left at the top of the screen, you see professional, you see professional signs that are done, so the message is clean and neat. You're going to see another slide a little bit later, and you'll be able to think about that and compare it. I took these pictures of 2 different swimming pools within 15 minutes of each other. Here's a swimming pool on the bottom. Again, perception, keeping things clean, keeping things neat, keeping things organized. You see how this is. This was taken last night at the end of the day, and I'm going to show you another one in a minute, so you keep that picture in your mind. Again, perception. This is a common area facility. We all have these, whether we use them for rent, whether we use them for income, social gatherings and stuff. We know that some of our rooms are closed now, but here's one that still is maintained in a professional way. It's cleaned every single day. Whenever we have realtors that go through the different buildings and things like that, it is perception. Perception is reality. It increases property value to keep our facilities up. We all know, we've all experienced this, right? Property values, concrete restoration. Here's a building, another building right on the circle. You see what picture on the left, which is under concrete restoration. We all know what that goes through. You see one on the right that is finishing. The units at the bottom are under, the units at the top left have all been completed. So you can see those stages. Again, what do we do inside and out to create property values? Here's something. I like this picture here because this is a garage. Most of us go into our garages and we don't give it second thoughts. This is a community here in Aventura that said, you know what? We have a responsibility within our community. So what are they doing? They're painting the entire interior garage.
Gary,
People go
I have to
inside
stop
and
you.
out. They're taking the time, they're taking the expense to clean the entire garage and paint it. One or two more photos and I'm done. Here's the have-nots. And I'll go through these quickly. Here's an entranceway in a community in Aventura. You see their driveway right there? Rest of the community looks good. First impression. Picture on the left. First impression of the entranceway. You see the one on the bottom right? Remember I told you to pay attention to that deck? This picture was taken 15 minutes later. So again, scheduling, using the facilities that we have and the people that we have. And on the upper left, this is a landscape job that hasn't been completed. It's been like that for several weeks. Again, first impressions. That's all I have in regards to pictures today. I think I stayed on time. Elaine's looking at me on the camera. So if anybody has any questions, Michael, I will take them. But again, the most important thing that I can relate within my 5 minutes is increasing property values inside and out. Take care of your communities. Many of your residents are home now. The only way we have within the condominium world to increase property values is to take care of the associations in which we manage and the associations in which we live. Michael, anything for me?
Yeah, I believe this will be towards you. If not, Dr. Marks, you can tell me if otherwise. Since the governor opened up everything, I guess it was yesterday, October 5th, do we as an association have to open up all of our recreational facilities and activities? And if so, does insurance in regard to COVID-19 cover the association?
Great question. And I will lead that off. I see Carolina there looking, she's smiling, but I will lead it off to what Dr. Marks said. A couple of things. One, always refer these to your association attorney if you have any questions at all. Secondly, that being said, again, as Dr. Marks said, every association, every municipality has the ability to follow the guidelines, but institute what works for them. What do I mean by that? When we first opened up swimming pools and things like that, we had the responsibility to only allow so many people in. If you're going to keep your chairs out, to sanitize those, let's say once an hour, sanitize your railings, limit the number of people, make sure you keep track of everybody that came in and out. As we go through phase 2, phase 3, and those things lighten up, we still as an association have a responsibility to maintain order and take care of those unit owners. So to the question, you can open up your facilities and you can open up all of the pictures that I sent you, the swimming pools, the fitness room, the recreational areas. But where I caution associations is having systems and processes in place to maintain those within the guidelines of keeping them clean, keeping them sanitized, keeping them in order. We are not in any way back to normal. We are moving in that direction, but we are not back to normal. So even though you can open them up, you must have processes in place to be able to maintain them within the guidelines that we have.
Thank you. Dr. Marks, back to you.
Thank you. And let me just mention one thing for all of you on this call. Just because the state has been opened by the governor, your local county may not be opening things up in the same way. So you've got to check with your local county and find out what they are doing. And then your city can also modify rules as long as they're at this point more strict. You can, when things are less strict, then your city can have something more strict and your county can have something more strict. So again, check with your local authorities before you make these kinds of decisions just because there's an overarching statement that everything is open now. And I can't stress enough the medical piece. Please check with medical experts before you just dive into the waters that are essentially being open to you right now. Thank you, Gary, for a great presentation. And it's my pleasure now to introduce Dr. Stacy Roskin, who is the president of the medical staff at the Aventura Hospital and Medical Center. She's also been a primary care physician in Aventura for 23 years. And I will tell you, I think that she's going to be able to talk to us about a lot of the things that have already been brought up. So without further ado, well, we also have, is Rochelle, Elaine, is Rochelle going to speak separately? I can't hear you. You're muted.
She's yes. I think she's.
Yes? Okay, fine.
Yeah, okay.
So right now, it's my pleasure to introduce Dr. Stacy Roskin first, and then we will hear from Rochelle in just a little bit. So without further ado, you're on, Doctor.
Thank you, Linda. Thank you for hosting this. This is very important. I was thinking Rochelle would go first because she's the ER part, but that's fine because I'm going to be talking
first.
about.
I can go first, Dr. Roskin.
Okay, because I'm going to be talking about discharge after the hospital when Rochelle's
Okay.
on the front end. So go ahead, Rochelle.
So still maintaining our process that we've had since the beginning of COVID. As to Dr. Marks earlier, as she said, we still need to maintain our masking in the community. That's a big deal, and social distancing. We're now going into flu season, so we're now extra careful because COVID has not gone anywhere. I know we've opened up a little bit, but it's still here. So we still have our entrance. We're still screening patients and family members when they do come in. We do have visiting capability, but it's limited to 1 family member per patient. And we do have visiting hours now. We still have, what we're using now is a kiosk where the patients can sign in. Yes, we have hand sanitizers, and it actually prompts you to sanitize before and after you use your kiosk. It allows us to actually see the patients as they're signing in, and there is a highlighted portion for us to identify patients that are under investigation for COVID. We still have our isolated COVID area. We want to make sure that even though we're seeing a decrease, we want to make sure that we're very vigilant. We're also going into flu season too, so the symptoms look the same. So our flu patients, COVID patients, we have in an isolated area, and we still have our main medical ER that we that to stay separated. Staff availability for PPE, still have PPE. There are no issues with our availability for PPE. So our patients are well taken care of. Staff is taken care of. We've not seen any staff illness recently, so that's a good thing. And that's pretty much what I have from the ER.
Okay, thank you, Rochelle. All right, so I was asked to speak on, thank you, hello, everybody. I was asked to speak on going home after COVID diagnosis. Okay, so somebody goes to the ER, they're diagnosed with COVID, and then the doctor makes a decision whether the patient needs to be hospitalized or not. And that's based on multiple different factors. But once they're admitted, they will not be allowed visitors, okay? And we keep them in the hospital until clinically indicated to go home. So the doctor makes that decision based on, again, different factors, usually based on their ability to take care of themselves at home if they live alone. And as long as they don't require a lot of oxygen supplementation, sometimes they can go home on low dose oxygen. Some of them already came into the hospital on low dose oxygen. And as long as their vital signs are stable. We don't wait for patients necessarily to be 100% or testing negative before sending them home. So a lot of times patients will go home after a day or 2 days with COVID, still infectious. So at that point, they go home with strict convalescence, strict isolation during the convalescence period. And some of them may need home health nursing at that time. So we do ask the property managers to be mindful of that, allowing nurses to come in and physical therapists. These patients need to continue being monitored and treated. Usually the convalescent period is about 2 weeks in most patients. And at that point, we have to make a decision on when to discontinue isolation. That used to be based on different factors. Now we pretty much limit it to symptom and time strategy as opposed to retesting strategies. So that means that we look at a patient's symptoms. in their last 2 weeks of their convalescence or their quarantine, as long as they haven't had upper respiratory symptoms, including the high fever or coughing or sneezing, and they should be okay. In addition to the time, again, 10 to 14 days is usually safe. We don't recommend retesting at this point because we found that some patients can be positive for months and they continue with viral shedding, but that doesn't necessarily mean that they're contagious or infectious. So, you know, retesting everybody on day 1 week, 2 weeks, 3 weeks, it just exhausts the supply and really doesn't give us any more information. So we feel safe to say that patients can be discontinued with their isolation after 2 weeks if they don't have any symptoms. Some patients, if they've had severe illnesses, may take about 20 days before they can be discontinued with their isolation. Again, 95% of patients after 14 days have shown to have no more infectious viral shedding. And so it's important to get these patients out of isolation, especially the elderly, because like Linda mentioned, I can't tell you, I think one of the biggest impacts of COVID in my elderly patients has been depression. And depression and isolation can be as deadly as COVID itself, okay? These patients need to get out, they need to have visitors. Again, strict measures in terms of masking. You know, masking is the #1 thing that has been shown to decrease transmission. So everybody, sick or not sick, COVID, no COVID, I really encourage everybody to continue masking inside the house. Well, if their patient was COVID positive, if not, definitely outside. But you know, so okay, let's go back. So the patient's convalesced. We decided based on the doctor's decision, again, the patient has been, can follow up with the doctor if they're fine, or they can follow up with the doctor via telemedicine. So it'll be a decision with the doctor and the patient, whether the patient can discontinue isolation. So at that point, exercise is very important for these patients that are convalescing or that are now able to go out. So exercising in their community, at the pool, again, very strict social distancing, separating the lounge chairs, strict sanitary measures, and like Linda mentioned, going to the gym if you have the personnel to wipe down everything after every patient. All this is important. Quarantining after a lot, I get this question a lot. I went into contact with somebody in an elevator. I was in the elevator, I found out that this patient has tested COVID. What do I do? You know, there's a lot of paranoia out there. Basically, if you come across a page, you find out that you came into contact with the patient, but you were wearing masks, the patient was wearing masks, and you were socially distanced, and you were with them for less than 15, 20 minutes, the chances of getting COVID are extremely, extremely low, okay? So you can pass that on to your residents, not to panic. You know, I think we need to be mindful of people's feelings because there's so much anxiety out there and anger and just rudeness. I mean, I was at Home Depot yesterday and I went to speak to one of the guys and he put up a rake in front of me, like to hold it, like don't get next to me. Last month I was at a fresh market and this older man took his cane, like get away, you know, 9 feet. I'm like, okay, you know, I'm always mindful of being socially distanced, but people get very anxious and they're concerned. So don't take it personally. Back away. I'm so sorry. Yes, sir. You know, in both regards. So the patient who's anxious needs to be a little bit more mindful, and also the person that's kind of being attacked. But with that being said, you know, since I'm speaking to the condo association, the property managers, I was trying to think of what's important for you guys. And one of the things I was asked, one of my girlfriends is a property manager in Boca, and she said, you know, what do I do when we know we have a patient that's COVID positive? And Linda touched on this briefly. But, you know, responsibility of a building management, a condo, although the condo association, sorry, they're not governed by HIPAA rules like medical doctors are, but I'm sure that they still have general medical privacy rules that you guys need to adhere by. So I definitely would not disclose any personal information. You can, depending on the condo laws, you can talk about, disclose the fact that there are patients, that there were residents that did test positive. But again, no specific information because you're going to discourage other residents that may test positive from coming forward. And you do want to have an idea of how many residents, if any, do have COVID so that you can properly manage and monitor the building. So pretty much, I mean, that's it. Be careful of pandemic fatigue. You know, we're starting to see that now with things being opened and people are letting their guard down. We need to stay vigilant in wearing the masks and strict sanitary measures, socially distancing. And, but again, with that being said, we also want to open up the lounges and the pools. One thing that I heard was one building, they keep their elevators open. And I thought that was a good idea, that when they're not in use, to help with circulation. But that's pretty much it. The other things I would recommend is the flu shot, like Rochelle mentioned, okay? Because we don't want to overburden the hospital system with flu and COVID at the same time. If a patient does get a flu, they are more susceptible to COVID or vice versa. And just, you know, encourage your staff and the residents to promote compassion and good old-fashioned neighborly love. That's all I have to say. I'll open up to questions.
Thank you. Thank you so much. Do we have any questions?
Yes, three quick questions.
All right.
I know, Dr. Roskin, you had said that you highly recommend people to wear a mask. Somebody's asking, is it an obligation that people do wear a mask outside versus community? I believe the question was community areas. I just copied the question as I saw it. So the question is it an obligation to wear a mask or is it not?
Well, again, it depends on the city and the local and state ordinances and the condo associations. I personally do recommend that somebody wear it at all times outside. If you're walking around the circle, let's say Country Club Circle, and you're socially distanced, you can just keep it down by your, you know, but underneath your jaw. I don't want older patients exercising with a mask on. That could be dangerous, especially in the heat.
Your thoughts on the 15-minute rapid test kits?
Depending on the test, I think it's fine. It's not 100%, but if it's available, I think we're ultimately going to end up using a lot more of them.
Last question. Can anyone who goes home with COVID get all the health protocols such as remdesivir, zinc, etc., and prescribed for home care?
No, right now that's not prescribed for home care, but we can, unless you're the president. But at the hospital, if you meet criteria, yes, you should be able to get remdesivir.
Thank you. That's it, Dr. Marks.
Thank you so much. And now it's my pleasure to introduce Carolina Sznajderman Sheir, and she's a partner at Eisinger Law, and she focuses her practice on real estate, condo and community association law, commercial and construction litigation, and developer representation. And Carolina is going to talk to us about the dilemma of enforcing health protocols. So boy, this all fits right together. Carolina, the podium is yours.
Carolina? Carolina, we can't hear you. Looks like you're unmuted.
Oh, sorry.
There you go.
Got now. Okay.
Good.
Thank you so much, and thank you for having me on this morning. I must say I've been at the edge of my seat wanting to, you know, chime in on some of the topics that have been discussed from my standpoint and what we get. You know, this is a very fluid situation. And, there's definitely some conflict between what your local authorities might be permitting and what is right for your particular community. So the first thing, and I must remind everyone that the board is charged with the responsibility of operating and maintaining the condominium, and also enacting rules and regulations for the health, safety, and welfare of the community as a whole. The board cannot guarantee the health, safety, and welfare, particularly in these circumstances, but you can take measures to protect it. The first line of defense for enforcement and for an association's board of directors and management is relying on your experts. That's what they're there for. You are a volunteer board. You have to exercise your fiduciary duties, and the best way to protect yourself, especially under what's known as the business judgment rule, is to seek guidance from your attorneys, from your cleaning experts, from your management to see how to properly undertake the challenges that we're facing, particularly with COVID. As to enforcement and the dilemma that we have, there's a couple of things. There's not enough meat and potatoes to the statute to enforce on the spot in a condominium setting. So, for example, we do have the ability to suspend use rights. We do have the ability to impose fines. However, there's procedural requirements that must be met in a condominium setting in order to be able to impose those fines or in order to be able to suspend those use rights. And since there is a 14-day time period between a suspension, the violation and essentially the suspension, it doesn't have much legs to it, which is why those things somewhat become a challenge. The other issue that I have and that we're facing is who's enforcing? Are you properly training your staff to be able to handle situations where somebody is refusing to wear a mask if the board has established rules and regulations requiring masks to be worn in all common elements? Is that going to be your front desk person? And what's going to happen if the issue escalates? We don't want to put your staff, your security guards, your front desk personnel, your property manager in situations where they're going to be in constant conflict with unit owners who are refusing to adhere by the regulations. Another issue that we've had, and I could speak for hours on, and we've seen it all at this point, or almost all. Another issue we've had is many associations want to seek out local authorities. We have somebody who is refusing to comply or refusing to quarantine, and they call the police department to try to enforce it. Well, now you're overwhelming the police department, and they may not be able to take much action. Likewise, unless we're dealing with an extreme circumstance, seeking court assistance to enforce the documents is not going to be timely, given the fact that whoever's not complying necessarily is exposing other members. So it's a very difficult situation from an enforcement standpoint. I think the associations really need to look at their rules and regulations. They can adopt special COVID procedures. Make sure that you adopt them at a properly noticed board meeting and that everybody is informed. Communication is the key. And that will help with enforcement. Put up the signs, encourage people to continue to wear their masks, adopt rules requiring masks to be worn in the common elements. This is all for the safety and protection of your members. I'd be happy to take any questions regarding some of the dilemmas that many of our associations are facing on a daily basis. I think the biggest one is people who refuse to comply.
Yeah, no other questions at this time. I have a general question, but nothing to do with Carolina. So, Dr. Marks, I'll hand it back to you.
You want to give us the general question?
Yeah, somebody would like to know what each of the condos are doing regarding Halloween celebrations inside or outside the properties. I don't know who to.
You know what? I'm going to take that question because okay. My background is in education and children, so I'm happy to take that question. And again, our kids are dealing with as much anxiety and depression as the adults are. And you have to be really careful about what you're doing with Halloween, because one association reached out to me and said, we're going to do a great job with Halloween. We're going to have winners. We're going to pick winners for each age group, for you know, the kids with Halloween, blah, blah, blah. And I said, stop right there. Right now, every kid needs to be a winner. You don't need to judge a kid on a costume. They've had enough drama if they're in school and having to be on Zoom all day and all the other things that are going on. So my suggestion to Halloween is as follows. If you have a large enough property, you can absolutely socially distance, walk the kids around the property, have somebody at the beginning, you know, leading the group, have a few people assisting all the way around. You can't really, trick-or-treating is an issue because it depends where you're going and how you're going, but your association can certainly get treats for the children, and the association can pass it out. So my recommendation, and again, this is from an educational standpoint, I've got 40 years as an educator, 15 years of that as superintendent of schools up in Illinois. So I've had, you know, a good amount of time dealing with kids. I would say celebrate the kids. If you can get them all out with their little costumes and socially distance them around, celebrate that, get a little music, a little cheering, pass out little goodies. It doesn't even have to be candy. It can be candy plus, you know, depending on the age, it can be balls, it can be Crayolas, it can be, you know, there's lots of other things that you can give to kids, but let's try to make them happy in a carefully socially distanced way. But actual trick-or-treating in houses or whatever, I think long and hard about doing that, because someone's touching the candy, then they're handing it to your kid, and then your kid's touching it. And so I think carefully about that.
Thank you. We do have a question that just came in for Carolina. Carolina, do you provide training sessions for board members for legal issues?
Yes, absolutely. We actually have a board member workshop coming up for election and budget season under COVID, and it's this Thursday, October 8th, 2020 at 12:30 p.m. I'd be happy to send out a link to register. We also have upcoming board certification seminar to provide board members and community association members with a board certification course in accordance with the Florida statute. So we routinely have training seminars.
Wonderful. Dr. Marks, I will tell you that we are exactly on, actually we're about 1 minute over our time lot, so I think we did great. Elaine, you should be very proud. So we're ready for the door prizes, I think.
Absolutely. Well, first of all, let me just say a thank you to Elaine and her team. A thank you to Marge for making the calls. A thank you to Hotwire and to Campbell Property Management. A thank you to all of our sponsors. I hope that this hour has been an hour that people have really had an opportunity to learn and also be validated with all the good things that you're doing. I'm going to ask our two sponsors to pick a number between 1 and 75. And after the meeting, we will be having Elaine call for door prizes. So Gary, can you pick a number?
46.
46 it is. And Hotwire, can we have a number, please?
Did I pick my own number?
You pick your own number, but we're going to change it. But go right ahead.
19. 19
it is. All right, Elaine's going to reach out to those folks right after. I'm going to thank all of you. I'm going to hope sometime in the next 6 to 9 months, we're going to be able to meet in person. But in the meantime, we'll be Zooming again, probably in a few more months. Stay safe, be proud of what you do, and have a wonderful, wonderful day. Thank you all.
Thank you, everybody, for joining on behalf of the Chamber of Commerce. Thank you so much. Enjoy your day.
So once you sign up, folder with them, they will call us.